Can everyone hear me? Am I audible? Dr. Dirk? Can you unmute yourself? Am I audible? All right. So let's begin. It's 11 o'clock, so let's begin. Hello, everyone. Yeah. My name is Qazi Sabiq Ahmed, and I'm your host. On behalf of Telemedicine Labs and Research, I would like to welcome you all to this interactive medical webinar that we have arranged for everyone today with a world-renowned anesthesiologist and pain specialist from the Netherlands, Dr. Dirk Peek. And likewise, I would like to thank Dr. Dirk Peek for joining us here today. So, as we all know, due to the coronavirus COVID-19 pandemic, a lot of you haven't been able to visit your doctors both home or abroad. A lot of doctors are not seeing patients because they are cautious about their health too. And so our company, Telemedicine Labs and Research Limited, has taken the initiative to eliminate the obstacles we are facing while trying to seek medical attention. Our company began its journey in India and has expanded into Bangladesh, where I, your host, am the company's regional director for Bangladesh, along with Ms. Alfie Kazi, who is another regional director of ours. And while I look after the technical and operational issues, she looks after our company's business development and PR activities in Bangladesh. And so I'm proud to announce to you all that we will be providing the opportunity for everyone in Bangladesh to request online private medical consultation with world-renowned foreign doctors and medical specialists. Every now and then, we will be hosting an interactive webinar such as this one with renowned doctors and health experts for you all. And then you will have the choice and opportunity to request an online private consultation appointment with world-class doctors such as Dr. Dirk Peek. Our contact information will be provided to you all at the end of this webinar. And so let me introduce to you all our doctor of the day, the world-renowned anesthesiologist and pain specialist from the Netherlands, Dr. Dirk Peek. Dr. Dirk, let's begin with your presentation.
Yes, well, thank you very much for the very nice introduction. I'm really honored to do online consultation for people in Bangladesh and also in India and talk today about chronic pain. That is one of my specializations. So I'm really very honored, and I like to talk about the chronic pain this morning. So I would like to ask Dr. Ayakub to start my presentation, to put on the first slide. Yeah, thank you. There it goes. It's not yet opening up. Yeah, well, it's always nice in the technique on far distances. So Dr. Ayakub, can you share the presentation, please? Yeah, okay, but before we start, we'd like to talk about the chronic pain. The chronic pain, that is really a burden in the whole world. And a lot of people are affected by it, also here in the Netherlands and also in Europe. So this is the topic, chronic pain. I usually start my presentations with the very famous painting on the right upper side. That's the painting from a Norwegian painter many years ago, and it's called The Scream. And if I talk to my patients, a lot of patients, they say, well, Dr. Peek, I'm really having a lot of pain. I would like to scream. And the thing is, if you have a close look at the picture, you see there's a lot of emotion involved. And usually you cannot see from the outside if there's pain. So a little introduction of myself in a couple of minutes. Then I'm going to talk about what is pain. I'm going to talk about the pain clinic here in the Netherlands. And then, of course, one of the topics will be arthrosis and arthritis, and also the difference between it. Also spondylolysis, spondylitis, talk a little bit about osteoporosis. And then the treatment of low back pain, shoulder pain, neck pain, and perhaps if we have time, I can answer some questions. So next slide, please. Again, Dirk Peek, I'm anesthesiologist, pain specialist. I had my education at the University of Maastricht. I worked a couple of years as anesthesiologist, also in Belgium. I did a full residency in pain medicine for a couple of years in Belgium. And currently I'm working at some private clinics and also in one of the biggest hospitals in the Netherlands. That's the Zuiderland Medical Center. Also, I am honor of the FIPP examen. That's the American Interventional Pain Examination. Next slide, please. So this is my hospital, one of the biggest hospitals in the Netherlands and also in Europe. I'm working here for about 5 years. Very modern, very big. We really like working here. Next slide, please. Yeah, this is how it looks from the inside. Yeah, sometimes a little bit ashamed of showing these pictures because it's too much of a big hospital. So the pain clinic here in the Zuiderland, and we have an outpatient clinic 5 days a week. We treat here patients and we do the treatment programs 5 days a week. Next slide, please. So what is chronic pain? There's a continuous multifactorial health problem in which physical, psychological, and social factors are contributing to pain experience, pain behavior, and the effect on daily functioning and reduction in quality of life. It's a long sentence, but it means that chronic pain has a lot of factors involved in it, and it is really a burden on the daily life of billions of people. It really affects the quality of life. Next slide, please. So worldwide, 1.5 billion people, so really a lot, and it affects all populations regardless of age, income, sex, race, ethnicity, or geography. So it's a disease all over the world, and it really affects 20% of adults. So 1 out of 5 people you meet on the street has some kind of a chronic pain problem. Also, on a yearly basis, we get a 10% newly diagnosed chronic pain problems, and it really one of the leading causes of disability, sickness, not going to work, etc. Also, we see a lot of spinal problems, osteoarthritis, arthritis, etc. And also one of the biggest burdens of pain is the people who are suffering from cancer. Next slide, please. So this is the chronic pain causes in Europe. I will not mention them all, but you see that we see arthritis a lot, migraine, so headache. We see fibromyalgia, and also cancer and diabetic. And also you see in the lowest bar that says rugpijn. That's a Dutch word, but that's the burden of the low back pain in Europe. So that's the biggest cause in Europe of the chronic pain. Next slide, please. So how does it work? I will not get into detail of it, but if you see this person is suffering from pain, so he cut his hand, you see it on the left down corner. Then there goes a signal through the arm, goes to the shoulder, and then it connects to the brain, to the brainstem. And then if it comes into the head, we call it then the cortex, then the patient feels pain. So something like the transmission of electrical signals. And this transmission is mainly facilitated by the spinal cord. Next slide, please. So this is if you do a transection of the spinal cord. You see on the left side the nerve roots coming into the spinal canal. And that's really something like a computer center. And from the spinal canal, the spinal cord, it starts transmitting all the pain signals to above your head. And if the signal arrives in your head, then you feel, hey, I'm having some kind of a pain. And the longer the pain signal exists, that's the bigger the chance of being a chronic pain syndrome. Next slide, please. Yeah, okay, so pain is very unpleasant. It causes tissue damage, and it's really real. If patient says it's real, then it's really real. If you see the small picture on the left side, it's a picture from Descartes many years ago, hundreds of years ago. And then they already thought about how pain was transmitting. So you see the person who is burning his feet, and you see the pain tract going through his leg, upper to his head, and then he feels, hey, I'm having some kind of pain. Let's pull out my leg from the fire. So it causes tissue damage. Okay, next slide, please. So what is chronic pain? There's a big difference from acute pain and chronic pain. So the definition nowadays for chronic pain is that pain exists for more than 3 months. So it's different. Then you get kicked on a football field and you feel numbness, and then it will go away within a couple of weeks. That's acute pain. Chronic pain lasts longer. So the definition is more than 3 months. And so what I said, one of the big problems is lower back pain and also pain in the leg. That's why they call the spondylolisthesis. I will show a picture of that in a couple of slides. Also arthrosis of the knee, the back and the neck, really big cause of chronic pain. Head and facial pain, also pain from your blood vessels. People who smoke too much, they get occluded vessels, and if they start walking, the blood will not enter the legs and it will cause pain. And also again, cancer pain. Next slide, please. So what if you're in Europe, in the Netherlands, you go to a pain specialist, you come on consultation, you do the anamnesis, so you listen about the history of the pain syndrome, then you do the physical examination to see where the pain points are, then you put in a diagnosis, then you think, hey, this is the cause of the chronic pain and we have to do something about that. And also if you start searching for the cause of pain, we can do an MRI, CT scan, or just conventional X-ray. And after we made the plan up, then we're going to think about the treatment. And we have very many treatments for chronic pains. So you can divide it into the needle treatments and the medication, etc. And I will go into the needle treatment a few slides further away. Next slide, please. So if you look at this picture, I think the letters are a little bit small, but this is really I call the Bible of chronic pain. You see about 20 or 30 chronic pain diseases which can be treated not only by medication, but also by needle treatments. And I will show the needle treatment a couple of slides further away. And you see all these are diagnoses and causes of pain which can be treated. Next page, please. So if I come to my pain clinic, then I'm going to decide which kind of treatment I'm going to do. We call it the interventional treatment. So then we're going to use the needles. And then, of course, you have also the non-interventional treatment. Then we're not going to use needles. So if you're not going to use the needles, then, of course, you have the pain medication. The pain medication has a lot of side effects. And sometimes you have to just use pain medication. Also, physiotherapy can be important. The same as the revalidation, the chiropractor or the ergotherapist who looks at your posture, and also the acupuncturist. So if you look on the right side, you see the physiotherapy, do all kinds of exercises. And then also the other picture shows the medications. But be aware of medication because a lot of medication has side effects, like morphine medication. Next slide, please. So again, about low back pain, it's a universal human experience. Almost everybody has some kind of a period of low back pain, and it usually goes away. It's a dull, aching, stabbing, or shooting sensation. It can occur suddenly without no cause. Causes are sporting, heavy lifting, it causes muscle strain, and also that some parts of your back can be damaged. Overdoing sport, do too much sport, and you do not do it in a good way, there's a big chance you get low back pain. You got some warning signs of low back pain. Usually it does not occur, but if you do not feel your bowel or bladder anymore, there is really an alarm symptom. Then you should see a doctor. Also numbness in the groin area, and also leg weakness and fever. If you have low back pain and fever occurs, go see a doctor because it can be something else than just low back pain. Next slide, please. So what are the causes of low back pain? Everybody knows it. It's a bad posture. If you sit television, computer just behind, it's very unusual bad posture, and then it will cause back pain. Of course, we have some risk factors. Obesitas, very big problem. Also, again, heavy lifting, but also arthrosis. And if you have arthrosis, there's a big chance you will get something like an episode of low back pain. Also the spinal stenosis and the spondylitis. And I will talk about that in a couple of slides. Next slide, please. So what about arthrosis? Yeah, that's the same as osteoarthritis. So what are the signs of arthrosis? That's a swelling, tenderness of one or more joints, the knee, the shoulder, the elbow. It causes stiffness and decrease of motion, so you cannot use your knee or your feet anymore. And the older you get, the worse you get. So it's really a part of your life. Almost everybody is going to do arthrosis. There's some common type like rheumatoid arthritis. So if you look at the osteoarthritis, I will not get into medical, but that's the breakdown of your cartilage, and that's really some kind of tissue that covers the end of your bone. And that's different from a rheumatoid arthritis, where your own immune system attacks your bone, attacks your joint capsule. It will cause inflammation, infection, and then you get pain in your knee or your elbow or your shoulder. And also, if you look at the low back pain, there's a degeneration, so arthrosis of one of the joints, in which your back moves forward, backward, to the left, to the right. Next slide, please. So this is a small picture about how it looks like. This is a knee. So if you look on the left side, that's a normal knee. There's no swelling, there's no breakdown of bone. If you go to the middle picture, that is really arthrosis. You see a breakdown, it's a little bit ribbling and a little bit of swelling. And then you go to the right and you see really a picture of rheumatoid arthritis. It's inflammation, swelling of your joints. So this is how it looks like from the inside. Next slide, please. So what about arthritis? Of course, there are some risk factors, like some families experience arthritis. Age, the older you get, the more chance you have of getting arthritis. Women are more affected than men in arthritis. And also one of the risk factors, if you have a previous joint injury, like if you're breaking your bone or your back or your feet. And again, there it is, obesitas. Obesitas is really a risk factor for all kinds of chronic pain syndromes. So what are the complications of arthritis? That you have difficulty in moving your arms and your legs. It can be very disabling, like if you have to work on your computer when you're experiencing arthritis, then you cannot work on your computer very well. It starts aging, it starts swelling, so you cannot work anymore very good. And also arthritis in your legs, then it's very hard to get to a store or see or meet your family. So that really can be a very disabling disease. Yeah, next slide, please. Okay, this is Telemedicine Labs and Research, Dr. Eerkoop. Yeah, okay, so this is the spondylolisthesis and the spondylitis. So spondylolisthesis, forget the word, is a medical term. It's just a sliding of your bones in your leg. So if you look at the picture on the right side, that's a conventional X-ray, and you see at the lower blocks, you see a sliding where the arrow is. So one of those bones, we call it in medical terms a vertebrae, is moving forwards. So if they start sliding again, if the bones are sliding, they will compress your nerves, will go from the back to your leg. You get pressure on your nerves, and then you feel the pain in your back, but also in your legs. And one of the symptoms is if you bend over, you will get less pain. If you ride a bike, you will get less pain. If you start standing up or sitting, then you get more pain. So we call that a spondylolisthesis. That's just a shifting of one of your bones. If you look at spondylitis, the word says itis, that means infection. That means there's infection or your bone, sorry, or other tissue in your back. So that's the difference. Between spondylolisthesis, that's a sliding. Spondylitis, that's an infection. That's what I said earlier in my presentation, that if fever is a part of it, see your doctor. So this is how it looks on the painting. So see on the left upper side, you see a crack, and that is one of the bones who's sticking out of your back. That can be crack, we call it spondylolysis. If you look on the picture on the right, there you see the slipping of your backbone, that is spondylolisthesis, it starts sliding. If you look at the picture on the most right, you see the stenosis, there's an occluding of the cord at your lower back, and it causes also a problem. We call it a spinal stenosis. So these are the three big factors of pain in your back and pain in your leg. If you look at the left downside, you see the hernia. So hernia is completely different than a sliding bones in your back. It just means that there's compression of your nerves from rhomboid disci. Next slide, please. Osteoporosis, also a very big problem in the whole world. It means that your bone becomes weak and becomes brittle. The older you get, the more chances you have of getting osteoporosis. So one of the things is, if your bones start getting brittle and become weak, just falling, bending over, or just simple a thing like a cuff can cause a fracture, so a broken bone. And well, the osteoporosis, the easy way to explain it, that the bone is living tissue and it's constantly being broken down and being replaced. But if you get older, the creation of your new bone does not keep up with the loss of old bone. So it is breaking, replacement, and that's a disbalance. And that's what really is about osteoporosis. So if there's more old bone in the body, it causes back pain. Also, that's one of the things why people are getting smaller if they get older. There's a lot of height because the bones are not really replaced anymore by new bone. Yeah, next slide, please. One of the risk factors, osteoporosis, that's lifestyle. For people who drink too much alcohol, who smoke too much, bigger chance of getting osteoporosis. Again, also, of course, obesity can be a factor of it. The treatment of osteoporosis, proteins, so a healthy diet, that's very important of treating osteoporosis or preventing osteoporosis, because you cannot cure it. Taking calcium, like in milk, vitamin D, and also exercise. Why is exercise so important? Because you have to put stress on your bones, your tissue, and your muscle to keep it all smooth. And the more exercise you do for this, the less a chance that you will get the symptoms of osteoporosis. It's not a cure, but it will give you less symptoms. Yeah, next slide, please. Again, here osteoporosis on the left side, you see the visible effect of osteoporosis. You get smaller, the more osteoporosis you get. The bones are getting really, really brittle. And you start bending over. I think everybody knows it if you see really, if you see older people walking on the streets. If you look on the right side, that's the picture of the bones in your back. There you see osteoporosis in your back. And you see the brittling. And the more old bone you have in your back, the more chances you get that you get a fracture. So it is getting broken. Very big problem, very hard to treat. Yeah, next slide, please. So this is about the pain clinic in Europe. This is my operation theater at my hospital. You see the operation table on the right side. You see the X-ray machine. You see all the kind of other machines which we are using here for treating the chronic pain syndromes. Next slide, please. So a little bit about the treatment. So this is a person who has low back pain, and he got the spondylolisthesis. So that's a sliding of your bone. So what we do on the pain clinic, we put the patients on the bed. We ask them to bend over a little bit. Yeah, next slide, please. And then we're going to put a small needle at the lower piece of your back, and we slide it between the bones, and we inject corticosteroids and local anesthetic. And we use those mixture to see if we can numb the nerves who get out of your back. Short procedure, takes about 4 or 5 minutes, and it can be very, very effective. So 1 out of 3 patients will have pain relief for at least 3 months. 1 out of 3 patients will not do anything about it. And 1 out of 3 patients will get about 50% pain relief. It can be a very effective treatment for the spondylolisthesis and also for the spondylostenosis. Yeah, next slide, please. So this is low back pain. This is a model of your low back. You see the yellow things, there are the nerves. And the white things, there are the bones of your back. And you see that the nerves are getting out of your back and then they go to your leg. So this explains why a low back pain and where the nerves are coming out of your back will run to your leg. That problem at your low back can cause pain in your legs, or your feet, or your toes. Yeah, next slide, please. So what do we do here at our pain clinic? We put on needles on those joints. You see the needle coming from the left. We put it on those joints. So we place the patients on the belly on my operation table. Then I'm going to use my X-ray machine. And then I put the needle on the joint and to treat it. And to treat it with current, electricity, and temperature to numb, to anesthetize the nerves who come out of the facet joints. Yeah, next slide, please. So how does it look? If you look on the, excuse me, on the right side, that's the picture we see on the X-ray. And you see the needles on the right side, you know, with the black thing on it. And then we put the needles using the fluoroscopy on the bones to treat low back pain with currents. Yeah, next slide, please. So this is what the pain are in your back. And you see here on the buttocks and your low back and the areas. And also you can see that the low back pain can extend to pain in your upper leg. Yeah, so pain in your upper leg can originate from your lower back. Yeah, next slide, please. So this is how it looks if we do the treatment. So the patient is on his belly. Then we're going to put on the X-ray on it. Yeah, next slide, please. Then we're going to put on the needles. Yeah, you see here the 3 needles who are placed on your lower back. They are connected to a machine, and the machine generates electricity. If you put electricity on these needles, then the tip of the needle will get a higher temperature, like 80 degrees. And if we do 80 degrees, we are burning on those nerves and to anesthetize them. So we're not going to make them dead or something. We're just going to anesthetize them. We burned a little bit and the nerve will regenerate. So we'll get better in a couple of months. And that's why the pain will always be back in a couple of months. And then we're going to do the treatment again. But in that mean period, when there's less pain, it can of course be very comfortable for the patient who experience low back pain. Yeah, next slide, please. Again, this is how it looks under the X-ray machine. We make the pictures. We make the pictures by placing the needles, and then we see if the needles are on the right spot. Next slide, please. Yeah, again a picture. That's the same picture. Next slide, please. This is the SI joint. This is a little bit lower than the vertebrae in your back. So this is more at the buttocks. And if you have problems with your SI joints, you will have pain on the sides of your legs. It also can be treated by needle treatment. Yeah. So this is again an X-ray from your SI joint. You see it then on the left side. And this is also again a needle treatment. This is how we make the nerve root treatments, again with the needle. Yeah. Next slide, please. You see on the right side the needle, we're going to do some dye. So we dye the nerve so that we can see the nerve on the X-ray so that we know that our needle is in the correct position to do the treatment. Next slide, please. Yeah, the next slide, please. And we also treat, of course, neck pain. A lot of people are experiencing neck pain. So what we do, we call it a cervical epidural. Again, we use the X-ray machine. And then we're going to put a needle in the back of your neck at level C6, C7. And the needle goes about 4 to 5 centimeters in your neck. And then we're going to do then the treatment. Then we give the local anesthetic to treat neck pain. Next slide, please. And this is how it looks like. It looks a little bit like it's a very painful procedure, but we anesthetize it very good. And again, it can be very effective for neck pain, but also, excuse me, for pain in your arms. Yeah, next slide, please. Again, this looks on X-ray because we're going to check out with X-ray that the needle is in the correct position. Procedure usually takes about 5 to 10 minutes. And then we see the patient back after 3 months at our outpatient clinic. Yeah, next slide, please. Again, the neck pain. A lot of people are experiencing pain on the sides of their neck, and then we can do the same thing as doing at the low back pain. Then we're going to put the needle on the facet joints of your neck, again using the X-ray. Now you see the needle coming. It can be very delightful to put the needles on the bone and we do the treatment for neck pain. Again, 1 of the 3 patients will have less pain for a couple of months. Yeah, this is how it looks like, because pain from the neck, from the joints in your neck, can also be symptomized by pain at your shoulder. So we call that, with a medical term, referred pain. Yeah. Next slide, please. Again, this is what we do with neck pain. We put the patients on the table and we go to put the needles from the side of your neck. We anesthetize that, of course. Procedure usually takes about 10 minutes. It can be very effective of treating chronic neck pain. Yeah. Next slide, please. Again, this is how it looks like on the fluoroscopy, on the X-ray. We check every procedure we do with X-ray. That's why it's a safe procedure. We do not see complications very often. Again, we make the pictures. It's a very safe procedure if you know how to do it. Yeah, next slide. Again, this is the pictures we make with the fluoroscopy. You see on the television screens, we do the continuous monitoring to keep the procedures in a safe way. Yeah, next slide, please. Also, shoulder pain. A lot of people are experiencing shoulder pain, like a frozen shoulder, or if there's a problem of your muscles in your shoulder. We also can do treatments of putting the needle into your shoulder, connected to a machine which generates electricity and temperature. Then we treat the nerve, we numb the nerve, we anesthetize the nerve, so you will experience less pain in your shoulder for a couple of months. So what did this is called a generator? I've talked about the machine which generates the electricity and the temperature. So this is the machine on the left side. That's from Equipe. And you connect the needles with this machine. You put the knob on, and then it starts working. And it gives current, electricity, and temperature to your needles. Yeah. Next slide, please. So these are the needles we use, very small needles. We got them in different sizes. So this is one of the needles we use for the treatment in the neck. So very small needles. Does not really hurt a lot if you put on the needles, because the anesthesia is very good. So see the white thing, that's the thing we connect to the machine. Yeah, and next slide, please. So this is the tip. You see a blank tip, and that's where the current comes from. So you can really put them very accurate on here. This is also another needle we use, very fine needles. Does not hurt placing the needles in the good way, if you put it in a good way, and if you anesthetize it good. Again, double needles. Yeah, next slide, please. This is also another needle we use for ultrasound, with ultrasound with the echo to do the nerve treatments. Next slide, please. And this is the connection we have, that we connect the needle to the machine. So that is what a short overview about the chronic pain. Like today, we did then especially the low back pain, the pain in the legs and in the neck. But there are many other topics we can discuss in the future, like pain from cancer, nerve pain, diabetic pain, etc. So we can treat all kinds of pain symptoms, also facial pain, trigeminal neuralgia. That's one of my specializations. A lot of people are having facial pain, headache, etc. So that's the nice thing about the chronic pain. It's a very broad and a very interesting field of pain medicine. So thank you. This is what my presentation. It's a short overview. I hope that everybody has a nice impression about what can be done about the chronic pain. So we can treat chronic pain. We can do it with needles, with medication, and this is the way how we work here in Europe, in the Netherlands, for treating chronic pain. So I hope that in your country we also can do chronic pain treatments like this to relieve the burden of chronic pain all over the world. And with help of telemedicine labs, I'm really convinced that we can do a very good job. So thank you.
All right, so now we will begin our interactive questioning session where you all have the opportunity to ask a question to Dr. Dirk.
Yeah.
If you want to ask a question, so please raise your hand in front of the camera like this, and we will select one of you randomly, and then you can ask your question to Dr. Dirk. So let's see if anyone has a question. All right. Fahim Adnan Khan. Mr. Fahim Adnan Khan, are you there? Yes, can you unmute? Can you unmute? We can't hear you. All right, so does anyone else have any questions? Please raise your hand. All right, UIY7 Prime, can you unmute and ask your question?
Hello. Hi, Doctor. Assalamu alaikum. My name is Dr. Azhar. I am a physiotherapist from Bangladesh. Would you explain role of physiotherapy in case of chronic pain? How should we manage a chronic low back pain or a chronic neck pain by physiotherapy?
Yes, so what about chronic pain and physiotherapy? If you look at the medical literature, that physiotherapy has some kind of a place in chronic pain. So what are the things is I advise to my physiotherapist is you do the graded exposure. And that's one of the things, of course, you can do about the chronic pain. And also the physiotherapy is depending on the age of the people. So if you have very old people, they will not start running, bending over, and this kind of things. So you just have to let them exercise in a way they feel comfortable with. So they have to listen very good to their own body, then all the body responses. And if you look at the younger people, for the low back pain, strengthening your lower back pain muscles, that's of course very important. That's important. Not using a corset at younger age, because the corset, then the pain will get worse, not in a couple of weeks, but in a couple of months, because you're not straining your muscle. So great exposure therapy is a good thing. About massage, you know, the getting the muscles like this, yeah, I'm not sure if that's really, it's comfortable for the patients. It will get pain relief for a short term, 1 or 2 days, and then the pain will get back again. So one of the things is you just have to ask your patient what they feel comfortable with. That's very important.
All right, so does anyone else have a question? All right, Mr. Fahim has raised his hand. Mr. Fahim, all right,
yes.
Can you, yes, so
Yes.
first of all, I would like to, Mr. Fahim Adnan Khan is the past president of Junior Chamber International Bangladesh and the current head of corporate affairs at Rankin Motor Bikes Limited. So Mr. Fahim, you can ask your question to Dr. Dirk.
Thank you, Sabik. Thank you, Alfie, to invite me in this session. And thank you, Dr. Peek, for such an insightful presentation. I would like to ask, I have this problem from long, since I guess from a younger age. I have this headache, which starts when I wake up in the morning. And I have shown some doctors here. They have termed it as a migrainal pain. Nowadays, what happens, like I have developed high blood pressure. So is there any connection between this migrainal headache with high blood pressure? I'm having regular medicine for blood pressure, high blood pressure. And when this headache comes up, I have naproxen sodium plus esomeprazole. So if you can show your, I mean, share your experience with this, please.
Yeah, so people with high blood pressures who are not treated very well, they can have headache, because if you have a high pressure, there's going to be more pressure in your brain, and then you can feel it like a headache. And if we treat here headaches with patients, we lower their blood pressure by giving them anti-blood pressure medication to lower the blood pressure and see if it gets less. So also for treating a headache, we also do the needle treatments from the back of your head. Put 2 needles on the left side, 2 needles on the right side. Then we can pour current and electricity on those nerves, and those nerves that run from your leg or from your head to the eyebrow.
Right.
And then we can put on the needles. Also, if you have the headache can also originate from the joints in your neck. The joints in your neck, especially the upper joints, are giving the nerves also to your head. So if there's arthrosis like here, or like a high
Mostly
strain on
this
the muscles,
headache appears in this section, and
Yeah.
it transfers to this nerve section.
Yeah, we call it occipital headache, called occipital neuralgia. It's typically like this. The nerve goes like this.
Right.
Yeah.
Exactly.
Yeah, to the front of your eyebrows. So we can do needles on the back of your head, but also you got here. Everybody can feel it. There's a little bit of a ditch in it. Then we can put the needles here for treating the chronic headache, and we can treat the chronic headache from the side of your neck. So there are needle treatments for chronic headache. Yeah.
Thank you very much.
But blood
Thank you
pressure,
very
that's a risk factor for sure. Also
Right.
about
I'm
the
having
chronic
regular-
headache, and that's one of the things. If people have headache, they start taking medication like paracetamol or naproxen. Does not go away. Take more medication, it will get worse. Then everybody thinks, and that's a natural reaction, I have to take more pain medication. But then the thing which happens is that your pain medication is causing your headache. So if people treating here with headache are neurologists, they stop all pain medication. And then you see that
Right.
in a big number of patients, that if you take the pain medication away, the pain gets away. So you have to think about that.
Thank you very much.
Thank you for your question. Good question.
All right, so moving on. I believe that over here, most of them are Bengalis. So I think a lot of people want to ask questions in Bengali. So I would to ask, tell people that আপনারা যদি বাংলায় কোয়েশ্চেন জিজ্ঞাসা করতে চান আপনারা করতে পারেন। আমাদের ইন্টারপ্রেটার আছে এখানে, আলফি কাজীও আছে, যিনি হচ্ছে আমাদের এখানে রিজিওনাল ডিরেক্টর বাংলাদেশের, এবং আমিও আছি। সো আপনাদের যদি বাংলায়ও কোয়েশ্চেন থাকে, প্লিজ আপনারা হচ্ছে আপনাদের ভিডিও অন করে হাত রেজ করুন। আমরা হচ্ছে আপনাকে অবশ্যই ডাক্তারকে কোয়েশ্চেন জিজ্ঞেস করতে আস্ক করব। জি মিস্টার জাফর আলম, আপনি নিজেকে আনমিউট করে কোয়েশ্চেন জিজ্ঞাসা করুন।
Okay, this is Mr. Jafar Alam. Thank you, Mr. Host, and thank you, Mr. Doctor, for your valuable presentation. My question is, I have a genetic headache. Am I audible to all you?
Yes,
Am I audible?
sure.
Yes.
I have a genetic pain in my head, especially I am going to point out in front of my this point, this section and eyebrow, and gradually transferred to the back of my head, especially in bitter winter season and in summer. I suffer more in 2 seasons, and some painkillers by the advising of local doctor, I use some painkiller like paracetamol, but it is going on years after years. No final remedy. So please, if any advice from your part.
Yeah,
Thank
so
you.
if you look like if you're pointing out on this side of your head, you call it arterite temporalis. That's something like a blood vessel which runs in that part. It's one of the causes of pain on this side of your head. But then your house doctor will recognize those symptoms. So that can be one of the problems. Also can be treated also by the needles on the back of your head. Yeah, put on the current, and then we're gonna numb it. Yeah, if you look at the medication, if you take too much medication, too much paracetamol, then it will get worse, the pain, too much. If you talk about the seasons, I heard it a lot. If there's
Yeah.
summertime, the blood vessels are opening up.
Especially in summer and winter. Summer and winter.
Yeah, so especially in summer, then your blood vessels are widening. That can cause pain. If you look in winter time, then your blood vessel will get smaller. And that also gives pain. So I heard a lot of patients. And if the wind is blowing outside, that can also cause pain.
Okay, just some more clarification. When it started, I cannot see correctly. It transfer in my eyes, even
Yeah.
in this point.
Yeah, because in that area, there are some nerves who are also running to your eye. So if there's something like a disbalance in that system, because all the nerves in your head are connected to each other, then a problem here can cause problem in your eye. But if you get eye problems, there are also a lot of other causes of eye problems, like glaucoma, a higher eyeball pressure. And so there are really a lot of causes of which we can cause pain in the area you're just pointing out.
Okay, thank you very much. Thank you very much. Thank you.
All right, and so we will be taking our last question of the day because we really don't have much time on our hands because it was supposed to be a 45-minute webinar, but it actually took much longer because everyone has questions. So does anyone have any other question?
I have.
Dr. Anwar Salam.
Yeah, so I actually
Dr.
want
Anwar
to.
Salam, please ask
Yeah.
your question.
Can you hear me?
Yeah.
Okay,
Yes,
so
we can.
actually, I want to ask a futuristic question. So basically, I want to ask whether you are already using artificial intelligence in treating your patients by analyzing the medical history of the patients, and what are your thoughts about the future, how artificial intelligence can actually help in medical treatment?
Okay. Yeah, that's also one of my hobbies is AI, artificial intelligence. Very important for the future. So the thing is, if we have a lot of databases in Europe, and I think also in your country, where data can be analyzed. And if you put on the analyzing of the data, then you can point out the patient groups who can be affected by chronic pain. And one of the things is, and that's an interesting thing about AI, if you can extract those groups of patients who are at risk of getting chronic pain, you can do preventive medicine. And that is one of the biggest issues with AI. If you use the data in a good way and you can extract the people who are at risk for chronic pain, you can do preventive. And that really will save a lot of cost, a lot of burden on healthcare. So I'm really very fond of AI, and it can be a challenge, of course, AI. Until now, I do not reconcile that AI is being used in chronic pain medicine, but that's of course, that's a very good one. I believe in AI. It will be very important. It is already very important.
Thank you very much.
All right, so now as we close, so closing remarks. First of all, I would like to close first in Bengali and then in English, if I have Dr. Derek's permission.
Yeah, sure.
Okay, all right. So আপনাদের সবাইকে আমি আপনাদেরকে জানাতে চাই টেলিমেডিসিন রিসার্চ আমাদের যে কোম্পানিটা আমরা বেসিক্যালি বাংলাদেশের মধ্যে হচ্ছে এখন অপারেশন শুরু করেছি, যেখানে আমরা ডক্টর ডার্কের মতো, আপনারা যেহেতু আমরা জানেন যে আমরা বেশিরভাগ সময় বিদেশি ডক্টরদের জন্য আমাদের বাইরে যাওয়া লাগে এবং করোনা ভাইরাসের জন্য আমরা এখন আর যেতে পারি না। সো আমরা বাংলাদেশে এখন এই সার্ভিসটা স্টার্ট করছি, যেখানে আমরা ডক্টর ডার্কের মতো ভিন্ন ভিন্ন দেশের সব স্পেশালিস্ট ডক্টর গুলোদেরকে সাথে আমরা আপনাদের অনলাইনে প্রাইভেট কনসালটেশন আমরা আপনাদের অ্যারেঞ্জ করে দিব আমাদের থ্রু দিয়ে। একটুখানি আমরা আমাদের কন্ট্যাক্ট ইনফরমেশন আপনাদের সাথে শেয়ার করব। আপনারা অবশ্যই যদি প্রাইভেট কনসালটেশন চান এরকম ডক্টরদের সাথে, আপনার যেটাই হোক, কার্ডিওলজিস্ট দরকার হোক কি যাই হোক, নিউরোলজিক্যাল ডক্টর হোক, আমরা সবার সাথে আপনাকে কানেক্ট করতে পারবো। আমাদের ডক্টরসরা আপনাদেরকে অনলাইনে দেখবে, আপনারা চাইলে আপনাদের প্রেজেন্ট মেডিকেল রেকর্ডস আপনারা আপলোড করে আমাদের ডক্টর সেটা দেখে আপনাদেরকে ইভেন ডিজিটালি মেডিসিন প্রেসক্রাইবও করতে পারবে। এবং আমরা টেলিমেডিসিনে আমরা আপনাদেরকে সবাইকে জানাতে চাই যে আমরা ইভেন একটা নতুন সার্ভিস হচ্ছে শুরু করেছি, যেখানে আমরা বিদেশি ওষুধ আপনার ডোর স্টেপে ডেলিভার করার এই সার্ভিসটাও থ্রু ডিএচএল আমরা এটা পারমিশন পেয়ে গেছি অলরেডি। সো এটা আমরা হচ্ছে ইন্ট্রোডিউস করতে চাই টু বাংলাদেশ, বিকজ এই করোনার সময় আমরা নিজেরাও জানি যে আমরা ডক্টরসদের সাথে সেভাবে করে দেখা করতে পারছি না। অনেক ডক্টরস আমাদেরকে সেভাবে সময়ও দিচ্ছে না, কারণ তারা নিজেরই রিস্ক ফ্যাক্টরটাকে তারা কনসিডার করছে অ্যাট দিস মোমেন্ট। সো আমরা আপনাদেরকে জানাতে চাই যে আপনারা যখন হচ্ছে বিদেশে যে অনেক হাজার হাজার ডলার খরচ করে ডক্টরস দেখতেন, সো সেটাকে এখন আমরা মিনিমালাইজ করে আমরা একটা সিস্টেম তৈরি করেছি। অনলাইনে আপনার ডক্টরের সাথে আপনার ফার্স্ট কনসালটেশনটা আপনারা নিতে পারেন, এবং ওটার পর ডক্টর আপনাদের রিপোর্টস দেখার পর আপনাদেরকে একটা ডায়াগনস্টিক্স রিপোর্টও দিবে। And surely we do want to say this, that you will get the best treatment possible through medicine. And so now in English, I would like to close by saying that I would like to sincerely thank all of you for attending this webinar today. I hope you all enjoyed it. And I sincerely hope you will spread the word with your loved ones that telemedicine labs and research is now here in Bangladesh, and you no longer with foreign doctors and health experts. And lastly, if any of you or your family member wants to request for an online private consultation appointment with Dr. Dirk Peek, then please contact us. We will be sure, as you can see, I think we are already, please, Dr. Yakub, please share our contact details. As you can see, we will be sharing our contact details with you. Thank you all for attending, and thank you from Telemedicine Labs and Research Private Limited, Bangladesh. Thank you so much.
Thank you. Honored. Really nice.
All right.
Thank you, sir.